Hi, my name is Celeste Balaban, and I'm a licensed clinical social worker at UCSF. I deliver this intervention in the research setting with participants, and I'm back here with you for Module 2. For an overview, you can visit Module 1 for an overview of the Y2TEC intervention, and then for tips on delivery, you can visit Module 3. This module covers the actual delivery of the Y2TEC intervention. And I'd like to give you a reminder that you can find more detailed information in our comprehensive Y2TEC manual on our website at y2tech.ucsf.edu. And in addition, we have those role play videos of counselors walking through and practicing the intervention on the website as well. All right, let's get started on our more in-depth overview and delivery of this intervention. So here is an overview of the Y2TEC delivery process. And this is just showing for the 12 sessions, there will be 12 weekly sessions. And for these sessions, there will be an initial session which focuses on a biopsychosocial assessment where you're getting to know them, you're identifying priority areas. And then that goes into core sessions, which are 4 to 6 based on their scores that they get on their surveys, which I'll go into more in just a moment. And then there will be 4 to 6 menu sessions. And then there's a final session. I also want to note that the intervention includes texting in between sessions. And this is for things such as appointment reminders, any reschedules, any resources that you're sending that may be helpful during or after sessions. Okay, this is a chart that shows a breakdown of how many core sessions are actually determined. So for the HIV sessions, low HIV knowledge, the score that they get on this 15-item questionnaire that I have an example of coming up, that will determine if they get both sessions, both the A and B sessions, or just the B session. Everybody's getting all the B sessions, but their scores, their survey scores are dependent on if they get the A and B session. So for the HIV session, it's that knowledge score, the knowledge questionnaire survey score that they have, as well as what their viral load looks like, if they're not currently taking any medications, or if they have no appointment within the past 6 months or no future appointments. These are all things that would lead them to have both, automatically to have both of those A and B sessions. If they're doing really well and on track with these things, then they would just get the B psychoeducation focus session. And again, I will go into more details on the breakdown of these sessions. For mental health, if they have elevated scores, which we're considering moderate or greater on the PHQ-9, looking at depression, or PHQ-8 if you're using that, the GAD-7 or the PCL-5. These would all determine that they would get 2 sessions instead of 1. If they're mild in all these areas, they would get 1 session. And lastly, for the substance use sessions, we're going to tailor the amount of core sessions that they get based on their scores on those substance use measures, including the audit, which looks at their alcohol use, if it's moderate or greater, and the DAST, and the assist. The DAST looks at the frequency of how much they're using substances, and then the assist as well, which looks at what substances they're using and the frequency again. So if they have daily use of a number, and you can go look in the manual for more specifics on this, but a number of substances such as cocaine, amphetamines, those types of substances, then they would get 2 sessions, or if they have daily use of any substances. The important thing here is just to note that the survey scores will determine how many sessions they get for each specific core area. Now, the structure of the core sessions are going to be the A and the B sessions. And the A session is focused on motivation. And the B sessions are focused on psychoeducation. So in that first motivation focus session, those are going to be provided to those again with those folks that have elevated scores on their HIV, mental health, or substance use. And this is going to help address the motivation component. It's going to begin with a counselor assessing challenges and barriers related to mental health or substance use or accessing and managing their HIV care through a review of the survey measures and a discussion, a collaborative discussion. And in this moment, you're having a discussion and you're assessing, not, this isn't the psychoeducation part yet. It's focused on the assessment. And then the focus moves into building the motivation to address these barriers that you just identified and noticing if they were resolved, what life would look like and what positive impact it would have on their health and their overall life and well-being. And then the structure of the core sessions, again, for the second core session, which is psychoeducation focused, that's going to be provided to everyone. And this just addresses the information. And this starts with the same assessment of barriers that you're noting, and then providing education and filling in those knowledge gaps, and especially filling in those knowledge gaps related specifically to any barriers that you identify, such as for example, how to identify mental health symptoms, and what different treatment options are. What would be the most appropriate treatment option for their specific mental health symptoms, or resources for managing substance use that are LGBTQ supportive, some things like that. And again, I will go into even more of a breakdown of the structure of the core sessions in just a moment. But I'd like to start with the initial session and just walk through an example of what each of these sessions would look like. For the initial session, we're going to start with an overview of the counseling series. And we're going to start that actually by doing this check-in. And the check-in is something we're going to do the same check-in at the beginning of all the sessions throughout the series. And this just ensures they have an adequate connection with their video conferencing, helping troubleshoot with them. If you already can tell in the beginning as you're checking with them, hi, thanks so much for logging in. Can you hear and see me okay? If they're having trouble right off the bat, it's a good time to just address it right then and there. Troubleshoot, also have a backup plan. Like letting them know if we continue to have challenges, is it okay if I call you by phone? After doing some troubleshooting with them. So that way there's not built up frustration and you're managing that right away. Okay, and then giving them information and just checking in at the beginning of each session. Where are you calling from? Is this a place where you feel comfortable talking and to meet right now for the next 20 or 30 minutes? Also letting them know what reschedule and no-show procedures are going to look like. And this will vary based on your program, but just giving them a good idea of what that looks like. Sharing boundaries for social media, just being able to share what can be accessed. A lot of times people are really curious and they might want to look you up or connect on social media. So just setting that up ahead of time and letting them know about your role and setting those professional boundaries according to what your organization has decided is important. And then confidentiality and limits to confidentiality, emphasizing that you want to create a safe space with them and letting them know what those limits are and sharing that. Next, you're going to move into introducing your specific role as a counselor. And it's really important here to make sure that you are emphasizing the difference between your role and the traditional therapist role. Whether they've had experience with a therapist or not, people often come in with certain preconceptions about what therapy might look like. And so this is a great chance to share what your role is, in that it looks more like a short-term supportive coach that's focused on helping them improve their healthcare and well-being and managing that. And then it's going to look a little different than a traditional therapist might, especially given the 20 to 30 minute time frame and the focus, the more specific, focus of topics for some of the sessions. Giving them also your availability, your contact methods, what they can expect, when they can expect an answer back from you. and reminding them about, that you'll be asking each week where they're located, and that's just so that you can provide safe resources if anything comes up and as far as where they are. And clarifying the scope and of the actual intervention and being really clear with them about the reason for the intervention. And just sharing that, we're using these 12 sessions and through the technology-based intervention to support people living with HIV, to help them improve their health, their treatment, their substance use, mental health, and a variety of other things. Also letting them know that other aspects matter too, that we're also going to look at things, other different topics that come up, like social support, romantic relationships, disclosure, and other things that may be pertinent to them. If you haven't already shared the session structure, length, and content, this is a great time to do that too. Letting them know that sessions are going to be 20 to 30 minutes each week, and that some will be those more structured course sessions, and they'll also have an opportunity to identify some different menu sessions and other topics that they're interested in. Next, you're going to go into the biopsychosocial assessment. And this is just looking at, as you can see, this is from the manual, some areas to explore in the biopsychosocial assessment. This is going to be 10 to 12 minutes, so you're not going to be able to hit every area, but just keeping it conversational and hitting as many of the general areas as possible. So being able to ask questions such as, whoop, sorry about that, such as tell me a little about yourself. Where do you live? How do you like it? Do you have family and friends nearby? And just really being able to have a conversation versus kind of rapid fire questions trying to make it down the list. Okay. Next, for in the initial session, after doing the biopsychosocial assessment, as you're doing that, you can keep in mind any things that they're bringing up that they want to work on or things that are coming up, because that's going to flow really well into this intake and priority area identification part. And that's where you're going to really assess with them and note any priorities that they're mentioning, challenges that came up, areas of need. For example, there's some examples here. I hear you saying it's hard right now because you're trying to find a place to live. And sometimes this impacts your ability to take your meds every day. And then also assessing and looking at where they're at in their motivation and their stages of change for any main issues identified. This is really like a great time to just mutually set the agenda to and to mutually know any of those topics that come up and asking them, what's important to you? What would you like to talk about? What are things that you're working on? What would you like to focus on? What are some things you think we should discuss together? And that can really help to assess that motivation and identify the topic areas at the same time. Then you're going to answer any questions. Make sure to leave a few minutes to answer any questions they might have, any concerns. I also like to make sure, for me, and acknowledge my own privilege and bring into this space any differences, how they feel working with a counselor that may have differences in identities or experiences than them, and bringing those things into that space as well. I find to be really important and helpful in building rapport, and in creating a really safe and really real, open, honest space. I also like to make sure and let them know that anything they're not comfortable talking about, they can let us know or let me know, and we can move on to something else. Okay, so answering questions and providing any information, giving them some reminders, especially for the text reminders they're going to get the day before the session, and then 10 or 15 minutes, depending on how you have it set up for the session. And then I really encourage you to leave on a positive note, giving a positive reflection of them showing up to the session with someone that they may not know, or may not know well, or any strength that they have, and just really trying to end each and every session with something positive that you noticed from them and really highlighting that. Okay, next I'm going to go into our core sessions and we're going to do a walkthrough of the core sessions focused specifically on what an HIV 1A and 1B session would look like for the core sessions. So we're going to do that same check-in that we're going to have for each session. And that check-in is, as a reminder, consent for the session and where they're currently at. Hi, where are you calling in from today? Or looks like you're in the same spot. Also ensuring they have an adequate connection, making sure they can hear and see me okay, confirming level of privacy if they feel comfortable. All of this can happen in this same conversation. And then I like to go in and check in on how their previous week went, how things are going, and just spend a few minutes. It doesn't have to be a long time, but just spending a few minutes seeing how their week went, how things are going since you last met, if there was anything that stood out to them from the last time that they met or that they wanted to continue working on. And for these sessions specifically, at the end of the introduction, I also like to give a reminder and let people know the next two sessions we're going to be discussing HIV care and letting them know because sometimes it can be difficult to get a private space or something like that, or they may have some friends around. And so giving them a heads up that the next two sessions are going to be focused on HIV care can also maybe help them to get some headphones or just keep that in mind so that they are in a space where they feel comfortable discussing some topics that may be more sensitive as far as HIV care goes. And just reminding them at the beginning, I like to say, hey, today's topic is discussing HIV care. Are you in a place where you feel comfortable discussing that today? And I always really just want to check in with them on that. All right. So next for the HIV Core 1A session. And as a reminder, the 1A is the motivation focus session. So this is for the folks that had those elevated survey scores or didn't have an appointment or any of those things on the chart for the HIV that qualifies them for an HIV 1A session. So then you're going to go into the assessment. And as a reminder, the assessment portion is not psychoeducation focused yet. It's really just noticing and noting what those barriers are, and getting to know a little more like what is their experience living with HIV and letting them know this is a topic that everyone gets. And so that we can focus on maintaining your HIV care, staying healthy, figuring out things that are coming up, um, and give them some extra support. So here are some specific questions that you can ask and some examples, and remembering that ORS for motivational interviewing, the open-ended, affirming, reflections, and summarizing, and really using that as you go through and asking a lot of permission, and some things like that. So checking in what their circumstances were around their diagnosis and what ways has it affected their life and what ways did they experience stigma, both from others or from within, and acknowledging those experiences they have in healthcare, what it's been like with doctors and clinics or other medical personnel, and how those experiences have been, what their current medication regimen is, attendance to appointments, if they're able to get labs, and just general strengths and challenges related to their HIV care routine. Really focusing on noticing areas of where there are barriers or things that are getting in the way. And just noting those things by reflecting it back to them and noticing for yourself as well as things to address. Okay, then you're gonna move into this part here is a little bit of the psychoeducation part for the folks that are getting the A session because you're gonna review the HIV treatment knowledge assessment with them. If you have time, you're going to review it with them. You can also do this in the next session as well to keep that focus. Sorry, there's a bug. Okay, so you can also do that in that session as well. And in the B session as well, but if there's time, this is also a good time to go over the HIV treatment knowledge questionnaire if they discussing any answers that they marked don't know, anything that they got that wasn't correct, and providing information and supporting details. And I like to do this in a really strengths-based approach by just affirming, hey, you did a great job, you got X amount right, or just sharing you have a really good handle on your HIV care. There's just a couple that you marked don't know, and are you okay if we go over those? And just going over those with them. And it's a great time as well to, if they have any additional questions about their HIV care or any additional barriers that they think of that they're bringing up. Now you're going to move into the assessing, enhancing their motivation portion. And this is a very important part of this ACE session because you're going to take those areas that you identified, those HIV care related barriers that if resolved, that they shared, especially noticing those ones that really would have a positive impact, those priority ones that they mentioned, and really affect their immediate and direct life satisfaction. And then you're going to do motivational interviewing around that. Discuss their motivators, their personal goals, their values, and just work to really build their motivation around addressing those barriers in that next psychoeducation session. One example of this is really identifying their value and their hope to find work and a goal that they might share of finding a job and how that's important to them. And saying, based on the conversation, it sounds like if you were able to take your medication more regularly, you might feel healthy enough to look for work or something similar. And then a checkout. This is a time where you will provide information about the next session and what to expect. Also get their feedback and thoughts on session, identifying any issues or concerns, and provide that positive reflection and appreciate their willingness to participate. Great. Now we're going to move on to this core 1B session, this psychoeducation focused session that everyone gets. We're going to do that same check-in that we do for all sessions. Now we're going to move into the assessment portion if you didn't already do it. So if this person did not get the A session, then you're going to move into and you're going to have an assessment portion with them where you are going through all of those questions, checking in, and looking at what their current barriers are. And here is a reminder of what those questions are and how they can really help drive the information and assessment process for identifying those barriers. Okay, if you have not gone over the knowledge treatment questionnaire assessment with them, this is a really great time to do that and can really kick off the psychoeducation portion and conversation. And it's a great chance and time to ask them, again, what additional questions they have. Send any resources that you may have if you're sharing an infographic. And here are some examples of some areas where you may provide different areas where you provide psychoeducation and health education. Like, for example, fitting clinic appointments into their schedule, how to choose and stick with a primary care provider or a clinic, things that may be important to them. Also, any different types of medications, how they work at the different stages of a life cycle. Some people are really interested in that, how drug resistance develops, how the labs can test for that. Common side effects, how to deal with them, getting labs done, what CD4 levels mean and look like. Also dealing with anxiety. A lot of anxieties come up, especially around challenges dealing with the healthcare system and past experiences. And so discussing anxieties around getting labs, around lab results, around just going for an appointment in general or talking to a doctor and trying to advocate for yourself. As well as medical literacy, things that can really help them to feel confident in their healthcare and what each thing means. And there is still a motivation portion of these B sessions as well. So then after going through that, identifying which barrier they'd like to address that would have the most positive impact for them. And really discussing what those values are, again, using those things that are really important to them to address those barriers. And then check out. Ask them again, getting that feedback, letting them know what to expect in a future session, and providing a positive reflection or a strength that they've had that you're discussing with them. All right, now we're going to move into a couple examples of menu session. Menu sessions, for a reminder, follow a similar structure with the added component of a focus on that problem-solving therapy. If you remember the IMB model that we discussed, that behavior portion, the menu sessions are going to focus on that behavior portion. They're going to have the problem-solving therapy focus, and they're going to have the added focus of a goal, of setting a goal at the end of session. Here are some menu session topic examples that people can talk about, and almost anything that they would want to discuss would fall under one of these topics. As you can see, there's a wide variety: romantic and sexual relationships, family of origin, self-identity and disclosure, the practical subsistence needs. There's also, I want to highlight a wildcard session. And this session is if in the moment they are having some sort of crisis or something that they really need to respond to in that moment, that gives you the option to have a wildcard session where you can discuss their immediate issue, or if it's a safety issue or suicidal ideation or something like that, that you can also address it at that time and do some safety planning. So we're going to go through an example of a menu session, and that example that we're going to use is subsistence needs. And this is like all the practical needs, like housing, access to food, any transportation, any of those kinds of things. So you're going to do that same check-in. And as well, when you do the check-in with the menu sessions, you want to check in for the weeks, if they set a goal the week before, any progress on the goal that they set and how that's going. Then you're going to want to assess and check in and get information on a focus area. So you're going to check in what impact does, for example, does not having consistent transportation have on your overall health and well-being? You're really trying to check in with them and get a specific area that you'd want to focus on. And then a barrier within that area. So it sounds like sometimes you have to cancel clinic appointments due to not having consistent transportation. So we have a focus area of transportation getting in the way of their health and them getting to their appointment. And then we have that barrier of having to cancel appointments when they don't have transportation and that specific thing. Then you can provide feedback and education as needed. Here are some examples. You seem very motivated to prioritize your clinic appointments, even when transportation is difficult, using that strengths-based approach and offering information using your motivational interviewing techniques as well by asking permission. Did you know our hospital provides bus tokens to all patients to and from appointments? Or do you know about different resources for transportation that you might use? Then you're going to move into the motivation portion where you're enhancing that motivation and checking in, maybe using a confidence ruler. How important is it for you to attend your clinic appointments? How confident are you that you could do it? What makes you feel this confident? What would make you feel more confident and give you that extra support? Then problem solve. And this is the highlight of the menu sessions because it's that added step where you might share with them, for example, you've thought about 2 ways to address this issue before our next meeting. The first plan is to research public transportation and speak to your social worker about getting bus tokens. The other plan is to talk to your partner about coordinating a ride. Which plan works best for you? And they might be able to think about and share and develop, okay, well, I when I meet with my partner or friend, sometimes it's hard to plan a ride for them because they're not always reliable. So maybe I'll start with the bus token, like I'll ask my friend if they can give me a ride, but then I'll also talk to my social worker about getting the bus token. So they may talk through it and then say, okay, maybe I'll start with getting bus tokens so I have a backup. And so that's where you help them to develop a goal and make a specific plan. And that's like, okay, I'm going to call my social worker today right after this session at this time, or I'm going to put a reminder on my phone to do this thing so that they have a really specific and measurable goal that they can take, a specific thing that they can do, action that they can take. And then you're going to do your checkout and make sure to highlight and appreciate them for problem solving with you and for Any strengths that they're exhibiting or sharing or that they have. Okay. Here's a couple of tips for menu sessions. Sessions are mostly determined during the initial session. So when you're discussing with them and you're IDing those priority topic areas, you're coming back to those in the menu sessions and saying, okay, we identified these specific areas as important to you as a priority. And making sure to come back to those priority topics that you discussed. There's also a lot of flexibility in topics and order. So if they have something coming up that week they want to discuss more, that's definitely fine. And you can be flexible from week to week and you can ask them what would be most helpful to talk about today. We discussed these two areas in the beginning. Would you want to address those, or do you have something else coming up this week? Or I really like this one where you're focusing on what topic would have the biggest impact on your health today, or something that really matters to them in that immediate moment. Also, setting a SMART goal at the end of session and asking about progress towards that goal at the beginning of the next session, as I mentioned, it's really key, and it's great to you can also continue ongoing goals. You can repeat a session if you need to and continue working on a goal. And then providing resources throughout the intervention as appropriate. Like, for example, in romantic relationships, you might provide a handout on disclosure tips and talk through or even role play how that might look. For self-identity and disclosure, you could give a handout on how to respond to microaggressions and how to care for yourself, or subsistence needs, details on hospital resources, on food pantry and resources in their area as far as that goes, housing, any of those kinds of things. And then maybe with family of origin, LGBTQ center schedule of groups or activities or ways to build community and support for themselves. All right. And lastly, this is an overview of a final session. After you've done those 11 sessions and you've made it to their final session, you're going to have that check-in. You're also going to check in on progress made towards any goals that have been set in that previous session. Make a modified plan if it wasn't attempted or successful, and this applies to all those menu sessions as well. You're going to take some time to review each menu and core. Ask them what stood out to them in this session or that session, and really identify and reinforce changes. Like, oh, I noticed you made this change in this area, and providing that positive feedback to really enhance the motivation related to changes that they made, steps they've taken, even changes they've considered that they might not have considered before. You're going to identify goals that are continuing, these ongoing goals, and identify any needs that they may have that could be supported by continued care. And for that, just providing resources, information, maybe even making a list together and sending that to them of things they can work on, continue to work on, and supports they need to help sustain their progress towards the goals that they're making. Things that will really give them motivation along the way, and maybe even if they're open to it, or things within their community that are going to provide that. If they're open to it, maybe longer term therapy and some things like that. And then for the checkout and goodbye, really providing some space, reflecting on the time that you've had together and their openness to take part in the intervention, giving them best wishes for the future, and just really honoring your time together and having that space to be able to give that closure, and making sure too in that 10th and 11th session you're reminding them, hey, just a reminder, we have 2 sessions left, or next session is our last session. And so that way they're also preparing and you're able to provide that closure. Thank you so much for being with me, and I'm going to end this presentation for Module 2 with some tips for delivering the final session. Prepare a short list beforehand of each session completed, the barriers that you identified, and goals, so that you can go through those quickly and easily and identify and highlight the successes, the goals, the topics that you guys discussed, and the barriers that were addressed. When it's possible to really note any ongoing goals they have, things that are incomplete, barriers that have come up, like really clearly, and that'll be ongoing, and resources that you can be already prepared with some of those resources that might be helpful if you have time to do that. And then be prepared to answer questions about long-term availability. People will often ask if they can continue or things like that. And so knowing ahead of time and being able to share with them that with them based on your organization and what your protocols are and what they've decided. Thank you again so much for being with me here on Module 2, and join me on Module 3 for tips and tricks or tips and pearls of wisdom for delivering this intervention. Thanks so much.